the interest of respect for everybody's time, we should call the meeting to order and start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And with that, I'm going to try to do myself out of a job here by conducting the election of a chair for the remainder of 2024. And the way this would proceed is I'll accept nominations. You may nominate yourself. You may nominate somebody else. We will, after the first round of nominations, we'll vote. And if we have a majority, that person will become the chair, and I'll move over a couple seats, and we can put that person in the chair or turn it over to the Zoom meeting as it might work out. And then that individual will repeat the process of accepting nominations for vice chair, and we'll vote on vice chair, and then we'll have new officers for the remainder. Hopefully we'll have new officers for the remainder of this, I guess, 2024-25 school year. So I will open the floor for nominations for chair of the Board of Health of the Township of Radnor. I can outwait you guys.
Since this is I feel like it's kind of a bridging time where we have people who have left and people who are coming on. I like the idea of old school management, and I would like to nominate David, even though I don't think he wants it, but I'm going to do it anyway.
Okay. Are there any other nominations? So I need to comment on that. I really believe that we need to develop new leadership. We are somewhat shorthanded. Maggie, I don't know if I can do this, but I'm willing to continue, but really not past the end of this year. So I'm going to we would elect new in January of 2025. If we get to January of 2025, I will not accept a nomination. I just have to say that. You guys, you need somebody new. You got to be tired of listening to me by now. So with that, since I'm the only nominee, I have to put it before the board for election. And if we do not have a majority in favor, then we will need another nominee. So all in favor? Well, I think we should probably roll call. So.
Are we voting for you, or are we voting on that it's okay for us to have a re-election in January? We don't need to do that.
We don't need to do that. It's the rules.
Okay.
January is when we
January we redo it. Okay. Aye for David.
Kiki?
I vote for David.
I abstain. That having been said, I'll continue to do this through the end of the year. Now, I don't have to change chairs at least.
Thank you, David. Your leadership is appreciated.
Thank you, Maggie.
Thank you.
I would like to start the election process for vice chair, and I have a nomination, and that would be Chloe. Are there other nominations? I know we have some. Kiki, I don't know if that's you or interference. But
it could be interference. I'll mute.
Well, why don't we get your vote, roll call in reverse? Okay. So we're voting for whether for Chloe for vice chair.
I wholeheartedly vote for Chloe for vice chair.
Excellent.
I think it's great.
I agree.
I nominated, so I agree.
Chloe.
By acclaim, Chloe is now our vice chair for the remainder of 2024. I love hitting that damn thing. All right, so we have sort of elected sort of new officers for the remainder of the year. And with that, let's proceed with agenda. So I don't know who else might have had a chance to review the minutes. I thought they were well rendered. I just have a couple of typos that I will submit offline that have no impact on sentences or meaning, and I'll submit offline. So can I have is there anybody who has any changes or modifications, addenda, or to the minutes? Then can I have a motion to approve the minutes?
A motion to approve?
Second?
Second.
In favor?
Aye.
Aye. By acclamation, minutes are approved with the caveat that I will submit a couple of minor typos. So with that, next is, to me, the most important part of this particular meeting, which is getting into gear and getting going on our student intern program. And I'm going to turn it over to Lisa and Seth for those purposes, and mute my mic and listen for a bit.
Alrighty, so we had 16 applications for Board of Health student intern for this year. Exact number, I'm not sure, but about 2/3 were juniors and about 1/3 were sophomores. And David and Seth assisted with reviewing the applications. They were absolutely wonderful. You know, you had to kind of go back and reread them again, and because there's none that you like looked at and you're like, nope, 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 no. Everybody was excellent. We have we selected 2 interns, which are joining us for this year, and their names are Alice Schneiderman and Hannah Kim. I'm going to have them introduce themselves and tell a little bit about why they wanted to join the Board of Health, and then talk about a little bit what they're interested in for their project. Now, last year, our plan, and when we had originally put out our plea for interns, we had Andrew and Lisa who were willing to be mentors for the interns, and so neither of them are on the board at present. So we need to obviously get them mentors, but I wanted them to kind of talk about what they're interested in looking into, and then if you would, if anyone's interested in being a mentor, I mean, you can state it during the meeting if you want to think about it, and email me. That would be fine as well. So Alice, let's start with you.
My name is Alice Schneiderman. I'm a junior at Radnor High School, and I was interested in this position because I'm really interested to see how public health works, and especially in Radnor Township. So I'm really grateful to have this opportunity. And for my initial project idea, I had what I was thinking was to focus on how physical exercise, nutrition, and breathing techniques can help reduce stress in teenagers. And I chose this topic because I found that, especially in junior year, I'm noticing that a lot of my classmates are dealing with the same things I'm going through, which is kind of juggling a lot of APs and honors classes, and just taking a moment to realize how important it is to kind of reduce your stress, as it has a lot of negative side effects. And I was thinking through these 3 different ways, if making posters or anything like that around the school can help raise awareness. I think that's really important, especially for students at Radnor High School.
Hi, my name is Hannah Kim, and I am a sophomore at Radnor High School. I was interested in the Board of Health position because I think I am interested in going into the health field, and public health also interested me, and I'm so grateful for the opportunity. And I wanted to research the impact of poor nutrition and physical activity on people, especially students in high school. And I wanted to assess the types of meals provided to students at the schools in the Radnor Township and study its nutritional value.
Great. So I do think we have, board members that could assist with both of those projects. I'll put myself out there for willing to be a mentor for either project, depending on anybody else's specific interest, or if we have a lot of interest, I do not have to assist with the student intern program. As I have the past few years, I can give other people the opportunity as well. So just wanted to put that out there if anybody has any comments at this time, or like I said, you can contact me as well.
So let me ask everybody to please consider, from when I joined the board, I think this is my 7th year, because I think I joined at the end of an incomplete term, and I'm in the 2nd year of my 2 3-year terms. I'm off altogether a year from December. And the one constant throughout the whole time has been the internship program, and it has been hugely valuable for the interns, for the board, and for the township. And I can't imagine it wouldn't be rewarding for whoever might intern. I kind of disqualified myself because I'm so many generations removed. I'm a superannuated boomer, and I don't really understand the communication skills may be required, but I will absolutely help Lisa if I can, but I really think we need to get other folks involved. And while I'm talking about getting other folks involved, I think we have an empty seat. One empty seat, Maggie? One empty seat, which should absolutely strive to fill as soon as we can. So if you know about anybody who's interested, and then I just looped that in because we're talking about the process of the board. I would say that every application I saw were fabulous students with fabulous records who put together excellent applications, and we kind of made our decision amongst a wealth of opportunities based on the interest in the projects that the students brought forward. So congratulations to Alice and Hannah, and there's no shame if any of the others are watching on the channel. Your applications were great, and we wish we could have more, and maybe in the future we will have more slots. Seth, any comments?
No, I'll just affirm that the applications were inspiring, and we really appreciate everyone's interest. It's always hard to choose from so many interested and motivated folks.
May I just say something? It's Jenny Lesage from the district. First of all, congratulations, ladies. That's awesome. And any assistance that I can provide getting everyone in contact with the people at the school that could possibly help this, just even listening to it. We have a food service department that could be of big help, as well as we have some psychologists at the high school that I work with daily that would be able to help as well for the mental health piece that you were talking about. So I'm available. You have my email, so please reach out to me. And same to you. It's Jenny Lesage, and I'm up at the admin building. Okay.
Thanks, Jenny. That's really wonderful. I think that's one of the things that grease the wheels and get things going. Really appreciate it.
And I think Alex would have said that for anyone who's really interested in it and did not get accepted this year, who's going to be a junior next year, they can apply again, and hopefully next year they will have the opportunity.
Yes, I did reply to all the candidates, and those who were sophomores, I did definitely encourage them, because I feel like in past years, a lot of the candidates that we ended up having had applied prior year.
Any other comments on the fledgling 2024-25 intern program? If not, I'll move on to the next item is old business. I do have one item of old business for Kiki on the phone, and we can take this offline, and that was I got an email from Alex about a program that had been scheduled and was deferred, and one of the follow-ups on, I think it was Savage Sisters, but I'm not 100% certain for scheduling. So I'll get in touch with you offline about rescheduling that. You with me, Kiki? On mute. I'll contact Kiki. And then I do have an item of new business, and that is in hallway conversation after our last meeting, Dr. Acker and I were discussing long COVID, and I'll talk about long COVID a little more next segment, but she offered to do a presentation to the board related to long COVID. I think more related to the mental health aspects of long COVID from a community and an individual point of view. But I would like, with permission of all involved, to add that for our next meeting, a 10-minute or so presentation on long COVID.
I think that would be excellent.
Excellent. Any other comments on old or new business before I move on to the next agenda item? If not, for those new to the table, I have, since about a year after I became chair the first time, in the midst of the heat of the pandemic, been doing community ID reviews, and have continued, and I will quit at any time the board wants me to quit, but I'm continuing now, so I'll ask your forbearance and talk a little bit about what is going on in general or specifically in our community. I don't really have anything specific to the Radnor community other than the infectious diseases that, well, I shouldn't even limit it to infectious diseases, because I want to start with a piece of good news on health-related issue. The CDC had their report on tobacco use among youth in this country. It just came out in the most recent MMWR, and there was a decrease from 12.1% of all high school students surveyed to 10%, and the bulk of the decrease in use is actually in e-cigarettes, which was the fastest growing segment. So that's good news, and it's runs counter to a lot of the trends and other health-related issues that we see. And I'd love to start with good news, because the rest of what I talk about is about getting sick. So the first thing I want to take up is there again was a report mentioned in this week's MMWR about pneumonias being on the rise, and I have an anecdotal report that some of the people I know working in the hospital system say the hospitals have been filled with pneumonias. Fortunately, it is not COVID, flu, or RSV pneumonias, but it's predominantly mycoplasma and rhinoenterovirus pneumonias occurring mostly in young adults and their family members to whom they bring them, but no significant reports of substantial morbidity or mortality. And I just bring that up to be careful in socializing in public and make sure that people aren't sick and aren't bringing it to you. Or if you're sick, don't bring it to other folks, and that's why Dr. Acker is not with us tonight. I hope I didn't just violate HIPAA, but I think it was okay. So from there, I would go to flu, which the problem with flu is that the newest flu report doesn't come out until the middle of this week. So the latest information I have is through October 5th, but by all parameters, ER visits, percent positivities, hospitalizations, there is very low flu activity, which is good. If you haven't gotten your flu shot yet, it's probably a good time to get it. If you're one of these people who tries to follow closely, you could wait and see what the most recent CDC report is. It's playing a little bit of a game. I said, it's in the minutes, my best day for getting it, if you're not really following activity, is October 15th, remembering that the window of coverage from your flu vaccine is not long enough to cover earliest to latest possible epidemic peaks. And so if you can know that there's no activity, you wait till mid to end of October, and that's a good time to get your flu shot, which I would encourage. I don't really have anything else to say on flu. The southern hemisphere outbreaks have been moderate, but the efficacy of this year's virus in the southern hemisphere outbreaks has also been moderate, remembering that the inoculation is a protection against severe disease, hospitalization, and death. It doesn't mean that you can't get flu, but the other thing that was apparent from the flu report on this year in the southern hemisphere is that the species that have been found are all susceptible to the antiviral medications that you can get if you get the flu. And that's all I have on flu. COVID is pretty good news. There was a COVID peak that occurred starting at the end of the summer. By wastewater, it peaked in early September. Wastewater is the only current longitudinal tracking that we have, but reportability will start again, and I don't remember the exact date, but reportability is starting again, so we should get good data again. The only data we've had for about a year is wastewater, percent positive, ER visits, percent positivity on ER, hospitalizations, and death. Hospitalizations peaked at mid-September. Deaths appeared to have peaked in late September, and all of them are trending down. It looks like the peak has come and gone. However, COVID is still out there. I don't want to spend too much time. Vaccination at this point becomes a personal decision with you, your family, the people to whom you might cause exposure. The vulnerable remain those at the extreme ends of the age spectrum and those with immunodeficiencies. And it's editorial comment. Remember, it's not just you. It's the people that you come in contact with and your community, and the decisions that you make are not just about personal rights, they're about personal responsibilities. That's my editorial on that. There are two other things I would report on. One is pertussis, which is on the rise. It was up a little bit last year from the year before. That was being attributed to some of the social isolation as a consequence of COVID, but it's significantly on the rise now. It appears to be causing, I don't have anything quantitative, causing more severe disease in the youngest, most susceptible, with hospitalizations starting to rise. But the other aspect of that was there was also a report on opting out for required inoculations, which is also on the rise. And I do not believe that it's a coincidence that we fell below the 95% mark went over the 5% mark. So the inoculation with pertussis dropped to below 95% at some time in the beginning of this year. And here's pertussis. And the other thing that I would point out is measles, which we've discussed. There were a total of 59 cases in 2023, which was 50 more than the year before. There are already 269% this year, 88% in totally unvaccinated, and another 77%, so 95% in unvaccinated or incompletely vaccinated, and the hospitalization rate for measles is 40%. Now, a lot of the people out there haven't seen what a real measles epidemic looks like, but it's miserable for the majority of the people, but not serious or fatal. But serious measles and fatal measles is an ugly thing for the children of our country. And if you haven't seen it, you might think, oh, vaccinations. No. If you've seen it, you understand why measles vaccinations were brought to the fore. So that's it for me on the community infectious diseases review. And if anybody has any comments, please now. So next on the agenda is Dr. Maggie Myers for a Board of Commissioners update for the Board of Health.
Thank you. Hello, Maggie Myers. I'm president of the Board of Commissioners, and I'm the liaison to the Board of Health by virtue of being a medical doctor. So I have not much to add. I have a totally extraneous comment, which is midnight tonight is the last time you can register to vote in Pennsylvania for this election. So has nothing to do with public health, probably. Otherwise, we're knee-deep in budget season, a lot of land use, a lot of parking issues. You can imagine, but there are really no public health issues on the last few agendas.
Thanks, and I'm going to endorse what you said, register to vote, regardless of what your issues might be. From a Board of Health point of view, registering and voting for somebody who will promise to do things like supporting Medicare, supporting public health, that would be in the benefit of the populations and served and the remit served by the Board of Health of the Township of Radnor. Any other comments? Okay, and then the next is Jenny Lesage. Please, Jenny, if you'd be kind enough to introduce yourself, because I'm not sure everybody has met you, because last year it was, yes.
PT Cap,
PT,
yes, was
right.
last year. That is correct. Yeah, I'm Jenny Lesage. I'm the Director of Student Services at Radnor Township School District. And would you just like my update then?
Please.
Okay. So, this year started off really very well, but we do have an upcoming program that we've done now, as long as I've been there, since I've been working in Radnor since 2014. So we call it the Partners Meeting. So on the 1st of November, we have professional development, and our Partners Meeting is where we have all of we invite all of our psychologists and all of our school counselors, our social workers are the ones that really put it together. We invite administrators, our English language department, our special education teachers, and we also invite Karen Foundation and Lakeside Clinical Support that work within our buildings. And they all come over to the middle school, and it's called the Partners Meeting, and we have community partners that we invite in. And the community partners are, Child Guidance Resource Center, Domestic Abuse Project of Delaware County. We invite the Radnor Police that will be coming. Embark will be there, Foundations for Behavioral Health. I mean, it just goes on and on. We invite, it's almost 80 different agencies. They all come in, and we start this whole, it's a half day, because we recognize that the school community cannot work alone and work on children collectively. We need to work together for the healthy development of each one of our students. So our partners come together, and everyone is able to tell us who they are and what they do, and then the people inside Radnor are listening and get to mingle with the different partners. And then when we're done with that, we also always have a speaker. And this year, our keynote speaker is Haven Evans, and she comes to us from the Pennsylvania Family Support Alliance. And what her topic is this particular year is mandated reporting, and just trying to navigate the nuances of everything that we are required to do as employees in the school district. So that is on the 1st of November. As I said, we always look forward to it, and we've been doing this for many years.
General public is invited?
No, this is a professional development for our staff. We pretty much pack the one room that we have. But yeah, it's really important, because what it enables us to do is our staff then really understands all the different people that are involved, and we get them connected so that when they have a student that they see, they know how to possibly connect that family, that student, with the services that they may need.
Wonderful. Can we ask you to give us a report out for any relevant information that might come out of that meeting at our next
Sure, absolutely, I'll be here.
Excellent, wonderful, thanks. Anything else then?
For me,
Yeah.
no, I'm done, thank you.
And nothing at the school district that we should hear about that I might have missed in my community ID?
No, I think we started off, and it's always good, very quietly.
That's
That's what we like
No
to hear.
news is absolutely excellent news when it comes to that. So that brings us to the public comments section. And I don't see anybody in the room or on Zoom for public comment, and I'm going to make the assumption that means that there are no public comment participants. I would like to make a comment about public comment, and that is that we are the Board of Health. Restate, we are a volunteer organization that serves the Board of Commissioners in the interest of the service of the people of the township related to health issues. So when it comes to public comment, the requirement is that you be a resident or a proprietor of a business in Radnor Township. And we listen carefully to the comments that come, but I would ask, for the purpose of the minutes, that we ask the people who come bring topics that are relevant to the Board of Health and to what we can do to serve the community, and limit their comments in a time frame. At one point, we had to limit to 2 minutes. I think that's pretty short, but maybe limit comments to under 5 minutes and address the comments to the Board of Health and what we have to bring. It is not a spot for political scree. It is not a spot for anger or angry comments. And we listen, and my understanding is that our obligation is not to respond in the moment, but to take the comments and if they require a response, put together a response. So I just wanted to, those are in my mind the ground rules of public comment. And our next public comment will happen after the next election, so hopefully there will be less, it'll be less fraught, shall we say. So with that, is there anybody else that has anything that they need to say before we close out this meeting? If not, I want to welcome our newest folks, our new interns. Thank everybody for showing up, and ask for a motion to adjourn.
Motion to adjourn?
A second?
Second.
Meeting adjourned.